It's Andrea Tooley from AndreaTooley.com, and I am here with Dr. Carrie Thompson. She is one of the consultants here at Mayo Clinic, and I'm going to be asking her today all kinds of questions that you guys have been asking me that I think you'll find really interesting. So just before we start, make sure you subscribe to this channel so you never miss any videos, and don't forget to leave comments, and always check out my blog, and we'll get started. So, Dr. Thompson, why don't you just kind of tell us about yourself, kind of what your medical path has been, and what you do here at Mayo?
I'm Carrie Thompson. I'm a hematologist at Mayo Clinic, and I'm also a wife and a mother of 3 amazing kids. How did I get here? Well, I went to medical school at St. Louis University and undergrad at the same place. So I did a Med Scholars program, which was a full 8-year program, but it was kind of an easier into med school, if you will. Had a great experience, loved internal medicine from the beginning. So I met a great guy in med school. First year, we dated throughout med school and came up to Mayo Clinic together for our training. So I did 3 years of internal medicine here, got married at the beginning of 3rd year, and then I did 3 years of hematology oncology fellowship, followed by 2 years as a Mayo Foundation scholar. So the opportunity to do additional training when I went out to New York and did a master's degree at Cornell in health services research and research with the lymphoma group out there, which is now my specialty. So been back at Mayo since 2009 on staff, working in the lymphoma clinic and doing research and medical education as well.
That is incredible. You're such an inspiration, and she's such a mentor to so many of the residents here. Your career path is just incredible, so that's great. One of the big reasons I wanted to talk with Dr. Thompson today is because I get so many questions every day from mostly women saying, I want to have a family, I want to have kids, and I also want to be a physician. How do I make this work? People have told me that I can't have kids if I want to be a doctor, that it'll never work, I'll never have time for my family, and how do you make marriage work in medical school and residency? All these kinds of questions. And so I think Dr. Thompson is the perfect person to kind of address all those things. But first, I want to ask her about hematology. For those of you who aren't familiar with what hematology is or what kind of specialty that is, can you just tell us a little bit about heme and what it all means?
Yeah, so hematology is the study of blood and blood disorders, both benign and malignant. So we see patients with anything from anemia or thrombocytopenia to bleeding disorders, and then all the malignant hematology. So acute leukemia, chronic leukemias. I specialize in lymphoma, so we give chemotherapy, take people through cancer treatment, the survivorship period, and the life care at times. Transfusion medicine is part of it. There's a lot of laboratory-based stuff. It's some people have called it internal medicine on steroids sometimes, and it's very fun. Complex patients, a lot of inpatient care, but also outpatient care, very diverse, and it's intellectually challenging and stimulating. It's a great career. I love it.
Good. Were those some of the things that kind of drew you to heme? When did you make that decision?
So I loved internal medicine. I knew that. I loved the patients. I loved the complexity. But I thought I was going to do geriatric medicine. Initially, I spent all of my time in med school dedicated to geriatrics and started a home care program and had awesome mentors in medical school, both geriatricians. And I really love the elderly population. But then when I started residency, we do oncology as one of our mandatory rotations, and I just hadn't had exposure to cancer patients. I thought they were scary, and
sure, yeah.
I thought it was, everyone says, oh, oncology is so depressing,
Mm-hmm.
and I found that wasn't the case at all. I loved it for all the reasons I love geriatrics.
Mm-hmm.
The mostly older population is also who's affected by cancer,
Mm-hmm.
the complexities, the communication, the relationships with families, but then you throw in the chemotherapy part and the internal medicine part into it. So I thought, gosh, I really like this, but I got to do hematology first. And again, had no exposure to hematology until residency. And then I did the rotation and realized, wow, I love it. It's everything I love about internal medicine and geriatrics, but even more. So yeah, I made my decision during the early part of second year of residency, and haven't looked back since.
That's great. Really good. That's really good information for those of you maybe thinking you're interested in hematology or oncology. Okay, so now on to the big question about having children when you're training in medicine, being a woman in medicine, being married, kind of all of these things. What can you tell us about what you would say to someone when they say, I think I want to go into medicine, I think I want to be a physician, but I also want to have a family, and I've heard you can't do both.
Yeah, that's absolutely incorrect. You can do both.
Yes.
You can do both. It's totally possible, and you can do both and do them both well. However, I think you just have to set your expectations a little bit differently.
Sure.
One thing I've learned over the years is don't compare yourself to anybody else.
Okay.
Because if you're comparing, as a woman, comparing myself to a male colleague who has a stay-at-home wife and they're going to have a different career trajectory. Yes. So they're going to have different opportunities. They may have different ambitions and different goals for themselves, both at work and at home. And that's okay. So, figuring out your own expectations, which for me is that I want to be a good wife, I want to be a good mother, and I want to be a good doctor. And amongst those things, I have different goals for myself. And some people may have different things that are important to them within all of those realms. Right. And it's very possible to do them all as long as you have some good help, a really good supportive spouse, and expectations that are realistic. It's totally possible to do it all. So for me, we got married during residency. My husband's also a physician. Okay. He's a urologist, so his residency was very busy with a surgical residency, but we always knew we wanted to have a family. It was never a question for us. And, I think I had some very good family friends that are a physician couple that made it work. So I think I knew that they could do it, and therefore I could do it. Right. So we were going to start a family during training. It didn't work out for us during fellowship. Okay. Residency, for me at least, I thought it was too busy. I didn't want to have kids while I was also taking overnight call and such. Sure. So it didn't work out during fellowship, but right after fellowship, we had our first child. And during that time, I was doing a master's degree. I was doing research. So it was pretty easy to balance.
That sounds like a good time.
There's never a perfect time to have kids, but that was a good time. Okay. Then we started on staff, and that was a pretty busy time and a busy transition. But we also knew we wanted more than one child. So, and I was getting older. In medicine, there's usually a little bit of a delay with having children. You're usually not in your early 20s anymore. Right. You're usually in your early or mid 30s. So we decided to try right away again and have our second child. And then lo and behold, I got pregnant right away, and it was twins. Surprise! So that was quite a shock for both of us. And that was a super busy time in our life. That was hard. I had to go on bed rest, which was never in my plans. Wow. And then, so 3 months of bed rest, 3 months of maternity leave, and I was really concerned that was going to set me back from a career standpoint. And at the time, it really felt that way. In retrospect, it was one part of my career, a short part, with years and years ahead of me. So it really ended up being what I needed to do for my family, but didn't affect my overall career. So now we have 3 kids. My twins are turning 5 in a couple weeks. My older daughter is 6.5. Wow. We have a crazy busy household, but I wouldn't want it any other way. Yeah. So some strategies that have worked for our family, I think to make it work out, is one, supportive spouse. Huge. Yeah. Being organized. So
Sure.
we've learned the hard way. When you're not organized, things can happen. Like I could be on hospital service while my husband's out of town. Who's going to watch the kids?
Sure.
Yeah, we learned that lesson. So, so now we have a electronic family calendar.
Wow.
We check in with each other regarding travel because we both travel to conferences and talks and such. I literally got back last night from giving a one-night trip in DC to give a talk and just managing all of that. Yeah. And then having some great support at home too. So people do that in different ways for childcare. Some people do daycare. Some people have a lot of family help.
Yep.
For us, we've had a nanny. And we have an amazing, wonderful nanny. Our kids love her. We love her. She comes into our home every morning, leaves when we get home from work. Our kids adore her. She's been wonderful support and help to us.
So good.
Many people say, or feel this way at the beginning when they have kids, well, isn't a nanny, don't you worry that your kids are going to look at her as she's their mom, their primary caregiver, and you're kind of
definitely
in the background. And I remember having those worries when I first had kids, and gosh, it hasn't been that way at all.
Really?
No, they love her, but they know that she is their babysitter. They respect her, and they follow her rules, and they're very close with her. They tell her that they love her, and that makes me so happy. I don't feel like, oh, she's a replacement. I'm glad they love her. They should.
Exactly.
But they know I'm their mom, and they want me as their mom, and there's room in their hearts for two different relationships like that. So
that's good, because I think that's a valid fear. I've thought the same thing. I don't have kids yet, and I've felt the same way. Like, oh, that's a tough decision.
Right. Absolutely has not. It just hasn't been an issue at all, and the flexibility of having somebody who can come a little bit early if you have an early meeting, or stay late, like if my husband's late in the OR that day, it's made a world of difference for us. So having that, childcare where you feel really comfortable, I think has been key for us.
Yeah.
And then the other thing that has been really good is that after my twins were born, I previously was 100% full-time, and then I went down to 80%. So I work 4 days a week. I have my Mondays off, so I have a long weekend. Other than the weeks that I do hospital service, which is 8 weeks a year. But I get those days made up, so then I get a little extra time when I'm not on service. And that's been great. My kids will be in school full-time, all of them this fall, but up until now they haven't been. So I have one extra day to spend with them.
So good.
And also I have our nanny come for 4 hours on my days off. So it's kind of the best of both worlds. I get the kids, I get my mommy time, but then I also have time to do the things that you don't want to do with kids, like go get your hair cut or go to the grocery store with 3 little kids. Or some days I just go to the coffee shop and I bring my computer and I do work so I can catch up, but do it on my own terms, which is also really nice. I rarely come into work on my days off because that's my time, and that's been a really good balance. Yeah. I feel like my life at home is much more organized and not as chaotic with having an extra day at home. Yeah. And at work, again, I don't have the same, career path as my colleagues necessarily because they're here an extra day a week and they're not as involved with their children perhaps as I am. Right. That makes no difference to me anymore. I'm very happy with my life and getting over that comparison to others has been huge.
That's such good advice. And you can make the decision of how much you want to work and how much you want to scale back.
Yes.
How easy is it to go from 100% to maybe 80% or less than full-time if you wanted to do that for a couple years or so when your kids are young?
It depends on where you work and what specialty you're in. Okay. For me, it was very easy. I had people who have paved the way. Okay. Men and women alike, actually, that take that work less than full time to balance out personal life and work life. Right. So it wasn't an issue for me at all. Okay. I didn't do it right off the bat. I put in 3 years of full time before going back just to get established. Sure. But for my husband, it would be more challenging because he's a surgeon. And he could make it work,
Uh-huh.
but with the setup that he has a day a week of research,
Okay.
and so he would give up his day of research if he would cut back, and therefore he really wouldn't gain a whole lot out of it. So, but he's very jealous of my days off, I have to say.
I bet.
So, but there's many people, for instance, I mentor quite a few of our fellows who are graduating, and many jobs out there, not in academics, are, part-time, but it's really full-time. It's just 4 days a week.
Yep.
Or one of our new moms is graduating, and she has a job that's 3 days a week.
Wow.
With minimal call. So there's
great.
there's options out there, and for her, she's got young kids at home, and it makes good sense. So I think that's an important point, what you said, though, that it may not be forever. There's phases in careers, and great advice I got from my boss, the head of internal medicine, when I first was hired, was that there's phases in careers. You don't have to do it all at once. So there's going to be opportunities that come up, and they may be now, but you don't have to do everything now. You can delay something and say, you know what, right now I want to focus on research and maybe in patient care. And then 10 years down the road, maybe I want more of an administrative role or something like that. So that's the beauty of medicine, is that that I don't think I knew when I was in medical school or pre-med.
Sure.
That, patient care is always part of it, but there's other aspects as well. There's medical education, there's research, there's administrative things that you can diversify your career and take opportunities at different phases in your career.
That's really good. And you don't always know where your career is going to go. You don't know what you're going to enjoy and where you're going to end up being.
Absolutely. I never thought I was going to do hematology, first of all.
Sure.
I could have guessed that I would be involved in medical education because I've always enjoyed that. But, I'm also very involved with research, and I never would have dreamed that I'd have that much of a research career and have grants and that kind of thing.
Wow.
And that's been a very enjoyable part of my career. Never would have guessed that I would have had that.
That's so great. You're such a role model. I mean, really,
thank
really.
you.
So I want to ask you also, I know that you're really passionate about women in medicine, and that's something that you work on and you speak to people about. What kind of advice do you have to all the women out there who are aspiring to be physicians or in medical school or in residency? What kind of advice do you want to give, or what kinds of things do you want to put out there?
So for the young women out there thinking, I can't do this because I'm a woman and I want to have a family, and medicine is such a grueling career. If you love medicine, you can do it. You have to love medicine, though, I think, because it's not just a career, it's a lifestyle, I say, but it's definitely possible to do it. I always think of the work-life balance thing. Well, I think I like the concept of it, but the concept of when I'm at work, I'm at work, and when I'm home, I'm home, I don't think that's true.
Really?
No. I think you have to think of it more as fluid. So there are times when work has more responsibilities. So, for example, I just got back from D.C. from giving a talk, and that was purely work because I had to leave the house. My husband took care of the kids, God bless him, and did that, and that's what I focused on. And certainly I wasn't focusing on home at the time. I wasn't even there.
Sure.
But you know what? Today I'm at work, and my daughter has her first dance recital.
Oh.
She's 4, so it's going to be slightly ridiculous, but it's in the middle of the day. Well, you know what? I'm skipping my staff meeting at noon so I can hop over and see her 15 minutes of fame. Because that's what I want to do. So, you have to be a little bit more flexible and fluid and make it work. And so sometimes home is more important. Sometimes you're going to be more drawn to the things going on at home, whether the kids are sick or what have you. And sometimes it's going to be more work, but as long as overall it balances out and you're meeting your goals for what kind of doctor you want to be, what kind of mom you want to be, what kind of wife you want to be, then it works. But it's not black and white. There's many, many shades of gray, and figuring out how that works for you and your family is is key to happiness, but you absolutely can do it. One more piece of advice.
Yes. Tell us.
I've been very lucky to have mentors who are moms. So, you have your research mentors, you have some career mentors, but another really important mentor for me has been several mothers, physician mothers who are maybe 10 years older than me that have made it work. And getting advice from them in terms of childcare options, how to make it work when you're trying to get dinner on the table and you're working,
Yes.
What do you do?
Yeah.
How to manage a house, how to have a two physician couple, or even just two working parents.
Yep.
So the tips and tricks and support from those women has been huge to me. I'll be forever grateful to them, especially when my kids are all very small. I had three under two for a short amount of time. And without their advice and support, it would have been really hard. So finding those mom mentors is critical.
I love that, because you don't think about mom mentors. And that's so great to kind of emulate what these career women have done, and then also being a great mom. Yeah.
I have a quote hanging up in my office, which is right over there. And maybe I can just pull it down and
grab
read it.
Yeah.
Okay, so I just hung this up a few weeks ago. This is from Annals of Internal Medicine, 2014 article that was written about career women in medicine. Okay. So I'll just read the whole thing. And I hung it up because it's good to have these reminders. So,
and that's one of our big medical journals. I mean, it's a big academic journal.
Women also need to take some pressure off themselves. Most of us are lucky enough to have long careers with distinct phases. There is no need to do it all at once, right now. The true measure of a successful life in academic medicine, particularly for couples within the profession, may no longer be measured in grants garnered, papers published, or salary attained, but rather in the flexibility to balance career and family over a lifetime in a way that makes personal sense and achieves realistic goals in both arenas.
Oh, I love that. That's everything you just said.
Yeah.
I mean, wrapped up into, you could have written that.
Exactly. And, well, it's finding advice from other women who have made it work, too. That's been really helpful to me. And one more thing, I read a book that's written for working women. Okay. And I have to reread it because I don't remember all the fine points. But the title is Good Enough is the New Perfect.
Oh, nice.
And I love that, because you can't be perfect in everything.
Yep.
You can't always be the perfect mom. And that's true no matter what. If you're a stay-at-home mom, if you're a working mom, what have you. But it's just good to keep grounded and remember that, what is good enough for you, and what are the areas where you really want to be perfect, and the rest, what don't you care about? I don't care if I have messes on my countertops in the morning. My husband may feel differently, but there's things that you're not going to be as good at, and it's just accepting those things.
Okay, that's such a great philosophy. I love that. Thank you so much for this. I really think that this has been so helpful for all of us who are aspiring physicians like you, who are successful at home, successful in your career. So I really hope you all got a lot out of this. Thank you so much, Dr. Thompson.
You're welcome. Thank you.
All right, everybody, leave your comments below, and we'll talk to you soon. Bye.
Bye.